Hi guys, as Parliament reopened, the Health Secretary Steve Barclay is now in charge of confronting the biggest challenges to face the NHS since the pandemic, or perhaps in its entire existence. As we know, staff shortages both in social care and in the NHS itself are creating two problems: massive waiting lists and blockages in the system which have worked their way to A&E, resulting in ambulances unable to hand over patients quickly and causing delays to call-outs. So as one part of the problem stems from social care, it seems Steve Barclay has come up with a solution. Have a listen to this.
Mr. Speaker, let me set out the first of these with the measures I can announce today to provide support to the NHS and local authorities now. First, we will block book beds in residential homes to enable around 2,500 people to be released from hospitals where they are medically fit to be discharged. When combined with the ramping up of the £500 million discharge funding, which will unblock an estimated 1,000 to 2,000 delayed discharge cases, capacity on wards will be freed up, which in turn enables those patients admitted by emergency departments to move to wards, which in turn unblocks ambulance delays. It is important, however, that we learn from the deployment of a similar approach during the pandemic by ensuring the right wraparound care is provided for those patients released to residential care, which I have asked NHS England to particularly focus on. So it is the shortest possible stay on their journey home and into domiciliary care, and indeed it is in the NHS's own interests for those stays to be as short as possible.
Okay, there are a few questions to ask about this. Where is the staff? He's talking about moving people out of the NHS into social care. But as this has not happened already, and the reason why it hasn't happened is because there's a staff shortage in social care, then how is block booking beds going to change that? So his plan is to block book beds in social care, then move people out of the NHS into these care homes. These people are not going home, they're going into care homes, and this will reduce the pressure on the NHS. That's the plan. Now, they already have the money because he's talked about £500 million here, and he's talked about how many people he can move out. But the question has to be asked, why wasn't this done before? Well, the answer has to be that the care homes and the care sector in general doesn't have the staff, doesn't have the capacity. So what's changed now? If it's about money, surely they could have fixed it a long time ago, but they didn't. So it mustn't be about money, it must be about staff. And what has changed from last week to this week when it comes to staff in social care? I don't know. And it seems, and what's interesting, he mentioned the pandemic here. What happened during the pandemic where people were shuttled out of NHS into social care, and we saw the result of that. Is this a replication of that activity? Just get people out of out of the NHS and into social care, irrespective of social care's ability to cope. And maybe this is the plan, because the focus of the media politically is on the NHS at the moment. So if Steve Barclay can shift the focus away to social care, which frankly the media don't care about, if there's a problem in social care, well, we'll deal with that later on. Is this what he's trying to do? He's just going to offload the responsibility onto social care, just shuttle people out of the NHS into social care and then claim some sort of victory. While, as we know, social care doesn't have the staff, doesn't have the capacity, and that hasn't changed. I have no idea what he's trying to do here. Maybe it's a political game. Maybe it's an attempt to appear that he's fixing the problem. But if that is his plan, just to move people from the NHS into social care and not provide the support that social care needs, the staff in particular, then the problem will not be fixed. And I don't know if the care homes are going to reject patients because they don't have the capacity, or they'll just have to get by. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.